Mesothelioma symptoms. Mesothelioma, an enigmatic and formidable form of cancer, possesses a significant threat to human health. This insidious disease primarily affects the mesothelial lining of various organs, most commonly the lungs, pleura, and abdomen, peritoneum, but can also rise in the heart, pericardium, or testicles. The main culprit behind mesothelioma is prolonged exposure to asbestos, a mineral once widely used in industries due to its heat-resistant and insulating properties. Understanding the nuanced and multifaceted symptoms associated with mesothelioma is crucial for early detection, accurate diagnosis, and effective treatment. This video aims to delve deeper into the complexities of mesothelioma symptoms, shedding light on the diverse ways in which this elusive disease manifests. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by a licensed healthcare specialist before we proceed. The purpose of this video is to examine the numerous mesothelioma symptoms and throw light on the elements that lead to the condition's emergence. In light of that, let's start by talking about the numerous symptoms of mesothelioma. Respiratory symptoms. Mesothelioma's impact on the pleural lining of the lungs often leads to a range of respiratory symptoms. Dyspnea, or shortness of breath, emerges as one of the earliest and most distressing symptoms experienced by individuals with pleural mesothelioma. The progressive growth of the tumor within the pleura restricts lung expansion and impairs breathing. Patients may also develop a persistent and often dry cough, initially overlooked as a benign respiratory condition but persisting as the disease advances. Hemoptysis, the coughing up of blood, can occur in advanced stages as the tumor invades blood vessels. Additionally, chest pain, which may be sharp or dull, arises from the tumor's infiltration of the chest wall or irritation of nearby nerves. Wheezing, caused by narrowing airways due to tumor growth, can further contribute to respiratory distress and discomfort. Abdominal symptoms. When mesothelioma affects the peritoneal lining, it produces distinct symptoms related to the abdomen. Abdominal pain, often described as dull or intermittent, arises from the tumor's invasion of organs and nerves within the abdominal cavity. Swelling and fluid accumulation, known as ascites, can cause abdominal distension, leading to discomfort and a feeling of fullness. Changes in bowel habits, such as persistent diarrhea or chronic constipation, may result from the tumor's impact on the gastrointestinal tract. Nausea, vomiting, and loss of appetite can further contribute to weight loss and nutritional deficiencies, affecting the overall well-being of individuals with peritoneal mesothelioma. General symptoms. In addition to site-specific symptoms, mesothelioma can give rise to general symptoms that affect the overall health and quality of life of patients. Fatigue, an overwhelming sense of exhaustion and diminished energy, is a pervasive complaint among mesothelioma patients. It is often severe and debilitating and can significantly impair daily functioning. The causes of fatigue in mesothelioma are multifactorial, including factors such as anemia, systemic inflammation, metabolic changes, sleep disturbances, and the psychological burden of living with cancer. Loss of appetite, or anorexia, is another prominent symptom that contributes to weight loss, muscle wasting, and decreased nutritional intake. Consequently, patients may experience muscle weakness, decreased stamina, and a general feeling of malaise, further impacting physical functioning and quality of life. Although less common, some individuals with mesothelioma may also experience fever and night sweats, which can indicate systemic inflammation associated with advanced disease progression. Importance of early recognition. Recognizing the symptoms of mesothelioma at an early stage is of paramount importance for improved treatment outcomes and enhanced quality of life. However, the challenge lies in the fact that these symptoms are nonspecific and can be mistaken for other respiratory or gastrointestinal conditions. Moreover, the long latency period between asbestos exposure and the onset of symptoms, which can span several decades, further complicates early diagnosis. Therefore, Maintaining a high index of suspicion and promptly reporting any concerning symptoms to healthcare providers is crucial, particularly for individuals with a history of asbestos exposure, including those in high-risk occupations or environments. Increasing awareness among healthcare professionals about the link between asbestos exposure and mesothelioma is also vital for timely diagnosis. Diagnosing mesothelioma requires a comprehensive evaluation that includes a detailed medical history review, occupational and environmental exposure assessment, imaging studies such as chest x-rays, computed tomography scans, and magnetic resonance imaging, laboratory tests including blood tests to assess biomarkers like mesothelin-related protein, and, in some cases, a biopsy to confirm the presence of mesothelioma cells. Pathological examination of tissue samples obtained through a biopsy provides crucial information about the tumor's histological subtype and helps guide treatment decisions. Treatment approaches for mesothelioma depend on various factors including the stage of the disease, tumor location, overall health, and patient preferences. Multidisciplinary teams comprising oncologists, surgeons, radiation oncologists, and other specialists collaborate to develop individualized treatment plans. Surgeries such as pleurectomy or decortication or extrapleural pneumonectomy for pleural mesothelioma and cytoreductive surgery with heated intraperitoneal chemotherapy or HIPIC for peritoneal mesothelioma aim to remove or debulk the tumor. Radiation therapy may be employed to target and shrink the tumor, while chemotherapy, either administered intravenously or directly into the affected area, is often used to kill cancer cells and prevent their spread. Emerging therapies like immunotherapy, which harnesses the body's immune system to fight cancer, and targeted therapy, which targets specific molecular abnormalities in cancer cells, hold promise in improving treatment outcomes. The prognosis for mesothelioma remains challenging due to the aggressive nature of the disease and the often late-stage diagnosis. The prognosis depends on various factors including the stage of the disease, tumor size, extent of spread, histological subtype, and overall health of the patient. Unfortunately, many mesothelioma cases are diagnosed at advanced stages when treatment options become limited. However, advancements in treatment modalities and supportive care have led to improvements in overall survival and quality of life for some patients. Ongoing research efforts, including clinical trials investigating novel therapies, aim to further enhance treatment outcomes and ultimately find a cure for mesothelioma. In conclusion, mesothelioma presents with a complex array of symptoms that vary depending on the affected site and stage of the disease. Timely recognition of these symptoms, coupled with prompt medical evaluation, is essential for early diagnosis and intervention. By increasing awareness, improving diagnostic capabilities, and advancing treatment options, we can strive towards better outcomes for individuals affected by mesothelioma. Moreover, continued efforts in prevention, regulation, and public education are vital in reducing the incidence of this formidable disease and minimizing its devastating impact on individuals, families, and communities. Through interdisciplinary collaboration, research advancements, and a collective commitment, we can continue to unravel the complexities of mesothelioma and work towards a future where this disease is conquered. As always, we care about your health. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching.